Climate change obviously has a huge impact on what's, the entire animal and human health landscape. We have, in the last year and a half, learned a lot about how the world can be changed by a single disease, and how important that has the importance of that is really, I think, not lost on us. And so we really have to be thinking about how do we move ahead. We look at population migration, we look at changes in land utilization. All of these things will have a tremendous impact on human health and animal health. And so these are things that we at Michigan State and other universities really have to focus on. I want to talk about just a quick example of something that is going on at MSU, maybe a different view of One Health. And I think it shows how translation of basic science into practice, and then translation, actually conversion of that practice into another context is really has some great potential. So I'm going to tell you a little bit about the work of Dr. Zhiyong Ji. He is a professor in microbiology and has been working on a way to eliminate the vectors for dengue, Zika, and other mosquito-borne illnesses. And so the technology he's developed is to take Wolbachia, a bacterium, infect mosquitoes, and they can be released into the wild. They are then mate with the native population of those mosquitoes, and he's done this with Anopheles, and I'll tell you the translation piece is very interesting. So he's done this actually in the field in Mexico and in 2 islands off the coast of China, and basically eliminated the vectors from the population. It's kind of an amazing approach.
Activities here at MSU, and then I want to challenge us a little bit thinking about the future of One Health and some models we can consider. So I thought I'd start at the top. World Health Organization has a definition of One Health, which is it's an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes. So I want to point out that this is a definition that's very kind of human health, public health centric, which you would expect from World Health Organization. That's their primary mission. CDC is also a public health agency, and they recognize that the health of the people is connected to the health of animals and the environment. So their definition is it's a collaborative, multi-sectoral, transdisciplinary approach. And I like this part of the definition, working at the local, regional, national, and global levels, with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. So sometimes you'll see plants as a separate topic in One Health. And again, this is also a fairly human-centric definition. More definitions of health. I do bring up the One Health Initiative because this is kind of a nice collaborative effort. It's actually a movement, they define it as a movement to forge co-equal and inclusive collaboration between physicians, osteopathic physicians, veterinarians, dentists, nurses, and other science, health, and environmentally related disciplines. It goes on to list a variety of different associations that have signed on to this. And I do want to point out that we do have One Health offices or One Health departments within some of our key federal agencies. So CDC, USDA, and National Environmental Health Association. And this is the image you saw earlier. This is kind of the traditional view of One Health, which shows the 3 circles, the 3 major focal areas of animals, humans, and the environment. And where they intersect in the middle is considered sort of the realm of One Health. I think this image is starting to become a little bit dated. I'll show you a couple other ones. This one is one of my favorites, where it kind of talks about One Health as an umbrella. And I kind of like that because there's there's room, and there's a lot of room under an umbrella. The umbrella can expand. So this comes from One Health Sweden group, and you can see the same variety of disciplines underneath the umbrella. And I like this green in the middle because it talks about One Health really can be applied at the individual level, it can be at a population level, and then ideally at the much broader
system and required that all of their workers only drink the filtered water when they're out working in the fields. They're not allowed to drink water from home. A lot of them were drinking well water, and we found from our case control study that well water was more associated with being a case. So tried to eliminate this potential contamination that was occurring and see if it made a difference. And as you can see, it did. We cut it down in half in that first year and then down to 53 because they became very strict, and especially with the shrimp farm workers and drainage and irrigation workers also enforced that they only drank the water from the filtration system and not from home or any other source. And so we saw a dramatic reduction in the number of cases, which is what you want to hope for. And so having this as a positive outcome, I think, is really good. We still have a little bit of progress to make, but at least I feel like we're moving in the right direction, and that it really helps to show that this is some sort of water contamination that was occurring with them, and that we were able to eliminate that by improving
individual level clinical care and promote interdisciplinary collaboration while emphasizing transnational health issues and determinants. Sounds good, right? Sounds pretty like, yeah, that sounds about right. That sounds really good. Lots of good words in there. Well, interestingly, at the same conference in which this definition was developed, there was a Kenyan doctor who, I hit something there.
Oh, yeah.
Devices are not safe around me. Who also suggested the definition. Is it a concept fabricated by developed countries to explain what is, and I put developed, I should have put in quotes, because there is a conversation to be had about what actually constitutes development. But by developed countries to explain what is regular practice in so-called developing nations, right? All right. Unfortunately, his name is unknown, but we do know it's him. And then I have a very good friend, Dr. Yabi Diako, who is in Ghana and does outstanding work in genetic research there in Ghana, established a wonderful institute there. And he says, it's what pretty much describes what the health that is practiced in 2/3 of the world. And so the point of producing this is, as we talk about whatever we talk about, whether it's One Health, Global Health, etc., who is making these definitions, and what does it then imply in terms of how we frame issues, as well as solutions and interventions, and then who benefits from them. And if we don't have those very important conversations, what we do is we just perpetuate a lot of the issues, a lot of the dynamics, a lot of the forces that actually brought us to the place that we are in right now. Where is the frame of reference? Whose narrative is being centered in these conversations?
After building this thing for 10 years, we had our first call for proposals. So almost 600 scientists from 30 countries applied for 12,000 hours of facility use time, and this is for 2 years. But the normal operation is maybe 4,000 hours per year. So
kind of translate to the risk to the bird, or the risk to the bird population, or to harm. I mean, you can see an effect, but it could result in a beneficial outcome. How do you deal with that? So we have a lot of biomarkers of effect, but the link to harm can only be made at the population level, assigning probabilities or risks of harm. The other interesting thing, which I only found out very recently, is that good effects are not recorded. They're ignored in the radiation protection models. So you don't add in if you get a beneficial effect. And this is because the models are designed to prevent harm. So they don't bother putting them in. They also don't put them into this adverse outcome pathway analysis. It's adverse. They don't talk about beneficial effects that might result from the exposure. And another quote, we may one day have a data-consistent theory of everything, but until then we have to both acknowledge and deal with fundamental uncertainty. And this brings me on to the
recruited a number of faculty to think about this in a broad sense. This is a slide from Jin-Sing Lee, who we recruited out of Stanford last year. He's an electrical engineer thinking about wearables and sensors. He has a wearable for mental health sensing that measures skin conductance, cortisol, heart rate, thinking about neurotransmitter sensing, and again, the sensing of nerve stimulators that adapt to nerve growth. So he has some really beautiful technology based on stretchable and elastic, morphable materials that can be used in healthcare, and I like these.